General Arthrology. Well, curious about how our joints work. Starting with what is arthrology? Well, arthrology is study of joints, the structure that connects the bones in our body. They allow us to move, blend, twist. No joints? Well, you will be stiff as a statue. Joints, they are also known as articulation. Place where bones and cartilage come together to form a connection is basically a joint. Classification, they are structurally and functionally classified. Structural classification, when the adjacent bones are strongly anchored to each other by fibrous connective tissue or say cartilage, or whether the adjacent bones articulate with each other within a fluid filled space called the joint cavity. Functionally, it describes the degree of movement available between the joints, ranging from immobile to slightly mobile to freely movable joints. Well, depending on location, they are classified as fibrous, cartilaginous, and synovial. Well, fibrous has two types, that is synarthrosis, amphiarthrosis, cartilaginous synarthrosis, amphiarthrosis, and synovial as diarthrosis. What are these three types? Let's start. Well, talking about synarthrosis, it is an immobile joint, provides strong union for articulation of bones. It is important for protection of internal organs. Well, for example, your skull has sutures which protects our brain. So, talking about amphiarthrosis, they have limited mobility. Example, cartilaginous joints uniting adjacent vertebra or say pubic symphysis of pelvis. Then we have diarthrosis. Well, these are the freely mobile joints, and in this we have all synovial joints of the body. When moving on, types of body movements. We have flexion and extension. Within sagittal plane, they allow anterior and posterior movements. For example, take vertebral column, we have anterior flexion, which is forward blending of neck and body, whereas lateral flexion is the side bending or sideways bending of the neck. Then we have flexion, that is decreases the angle between the joints, and extension, which increases the angle, that is straightens the joints. Well, as you can see in this diagram, here this is flexion, here this is flexion, here this is extension, and this is extension. Here also, this moving your head forward is flexion, this is extension. Well, extension, flexion. So, coming to the next, we have abduction, adduction. Well, abduction, uh, these are the motions within the coronal plane to begin with and involves medial lateral motions of limbs, fingers, toes, and thumbs. Abduction basically is moves the limb laterally, that is away from the midline of the body, and adduction is basically brings towards the midline, that is towards the body. So just take an example. Adduction is that is addition to your body, that is coming closer to the body. Abduction means minus, that is away from the body. It occurs within the vertebral column at pivot joint or say at ball and socket joint. Rotation of neck or the body is twisting movement produced by summation of small rotation movements available between the adjacent vertebra. At pivot joint, one bone rotates in relation to another bone. Rotation can also occur at ball and socket joint as discussed, that is shoulder and hip. That is humerus and femur rotates around their long axis, which moves to anterior surface of the arm or thigh, which is either towards or away from the midline. Well, talking about supination, pronation, they are basically the movements of forearm. Talking about like in anatomical position, when palm faces forward, this is supination. Here, radius and ulna are parallel to each other, and in pronation, the palm of the hand faces backwards, and here ulna and radius forms an X shape. Flexion, they are movements at the ankle joint, which is a hinge joint. Well, lifting the front of the foot is dorsiflexion, whereas lifting the heel of the foot is plantarflexion. And these movements are only seen in ankle joint. Talking about inversion and eversion, basically they are complex movement that involves the multiple plane joints among the tarsal bones of the posterior foot, intertarsal joints, and thus are not motion that takes place in the ankle joint. Inversion is basically turning of the foot of the angle the bottom of the foot towards the midline, that is inside, and eversion the bottom of the foot away from the midline, that is outside. The foot has great range of inversion and eversion motion. Talking about protraction and retraction, well, basically they are anterior posterior movements of scapula and mandible. Protraction of the scapula occurs when the shoulder is moved forward. So moving forward is protraction, whereas retraction is opposite, that is moving backward or say pulled posterior medially towards the vertebral column. Well, talking about our last point, that is excursion. Excursion is a side to side movement of a mandible. Lateral exertion and medial exertion. Lateral is basically mandible away from the midline, that is right and left sides, whereas medial is returning to the resting position to the midline.
So let's get started with our first topic for today, that is fibrous joints. These joints helps the adjacent bones directly connect to each other by the fibrous connective tissue. Hence, there is no joint cavity present between them. The gap between these bones may be narrow or wide. There are three main types of fibrous joints. First one, that is the suture. Second is the syndesmosis, and last one is the gomphosis. We'll learn it one by one. So our first type of fibrous joint is suture. All the skull bones except the mandible are joined by the fibrous joints called as sutures. Suture in Latin means to bind or to sew. It helps protect the brain and form the face. In adults, the skull bones are closely connected with each other by this fibrous connective tissue. These sutures have a complex shape, which helps them form a strong tight connection between the bones and prevent movement. Hence, they are generally classified as synarthrosis. Some sutures may still allow for a bit of movement. In newborns and infants, these sutures are wider in areas and are called as fontanelles. They are found on top and sides of the skull. During birth, these fontanelles provide flexibility to the skull. They allow the bones to push closer or to overlap each other. So after birth, these fontanelles allow for rapid growth of skull and enlargement of the brain. They decrease in size and forms the joints called as sutures. So at some sutures, the connective tissue will ossify and be converted into a bone. This fusion is called as synostosis. For example, the frontal and the maxillary bones, which are earlier two in number, fuse by the age of 8 years into one. Later, the sagittal, coronal, and the lambdoid sutures fuse and disappearing with age. Here we are done with the sutures, and our second joint is syndesmosis. Syndesmosis is the joint where two parallel bones are united by this fibrous connective tissue. The gap may be narrow where it is joined by the ligaments or wide where it is filled with the interosseous membrane. For example, in forearm, we see the radius and ulna bones are united by the interosseous membrane here in between. Similarly, in leg, tibia and fibula are connected by the interosseous membrane. Third example is the distal tibiofibular joint. The bones lack cartilage and the gap is anchored by a fibrous connective tissue and ligaments, which is termed as the anterior inferior tibiofibular ligament. Lastly, the functions of these joints. These joints helps unite the parallel bones and prevent their separation. It allows some movement between the bones and hence they are termed as amphiarthrosis. It also provides strength and stability to the leg and ankle joint. It also allows for rotation of radius bone in the forearm. So, what are the consequences of the damage of these joints? There may be pain, there is loss of stability of the bones, there is muscle damage, and improper alignment of broken bones during healing if not properly immobilized. Here we are done with the syndesmosis joint, and our next joint is gomphosis. The fibrous joint that anchors a tooth into its bony socket is known as the gomphosis joint. It is also known as the peg and socket joint. It is located between the maxillary bone or the mandible bone and the root of the tooth. So what are the components of these joints? The bony socket within the maxillary or the mandible bone, secondly, the root of the tooth, and lastly, the periodontal ligament which helps in the attachment. Lastly, we'll talk about the function and classification of these joints. Functionally, these joints are classified as synarthrosis due to its immobility. Next, its function is to provide a strong and stable anchorage for the tooth within the jawbone. Here we are done with the three types of fibrous joints. Our next topic is cartilaginous joint. The cartilaginous joints are the ones which are connected by the cartilage, which is a tough but flexible type of connective tissue. It lacks a joint cavity. These bones are joined by either hyaline cartilage or the fibrocartilage. There are two main types of cartilaginous joints. First one is the synchondrosis, second one is the symphysis. So let's get started with our first type of cartilaginous joint, that is synchondrosis. In synchondrosis, the bones are joined by the hyaline cartilage. These joints may be temporary or permanent. They are functionally classified as synarthrosis, that is no movement at all. So let's first talk about the temporary synchondrosis. The epiphyseal plate is the growth plate in the growing long bones. In temporary synchondrosis, it helps in uniting the diaphysis and the epiphysis of the bone. The bone lengthening involves the growth of the cartilage and its replacement by the bone. The growth slows and stops in the late teens and the early 20s. The epiphyseal plate is replaced by the bone, fusing the diaphysis and the epiphysis. Next is the permanent synchondrosis. These type of synchondrosis joints are found in the thoracic cage. The first sternocostal joint. The first rib is anchored to the manubrium by the costal cartilage. The anterior end of the ribs is joined to the costal cartilage. It retains the hyaline cartilage and do not ossify with the age. Here we are on our last joint, that is symphysis. So symphysis is the joint where bones are joined by the fibrocartilage. It contains thick collagen fibers, making it a strong and resistant to pulling and bending forces. It allows for a limited movement and hence it is classified as amphiarthrosis. The examples are the pubic symphysis, the manubriosternal joint, and the intervertebral symphysis. So, what are the importance of the intervertebral symphysis? It allows for a small movement between the adjacent vertebrae and it also provides cushioning between the vertebrae, important for heavy lifting or high impact activities.
Now, guys, I am going to talk about synovial joint. The synovial joint consists of cavity or space between two bones, in which the cavity it contains fluid called synovial fluid. Because of this synovial fluid, the joints are easily movable. In synovial joints, there is an articular surface. Here you can see, and for another one, this is the articular surface. Below the articular surface, there is an articular cartilage, and then the characteristics of synovial joint. The first, basically, because of synovial fluid, it will minimize the friction between two bones and it will absorb the shock, then articular capsule. The so basically the synovial joint has joint capsule in which the outer layer called as fibrous membrane, and the inner one is called as serous membrane or synovial membrane. The fibrous membrane is made up of fibrous connective tissue and the synovial membrane is made up of serous connective tissue, and the synovial membrane is responsible for secretion of synovial fluid. So what is synovial fluid then? The synovial fluid is a thick, sticky fluid which fills the synovial cavity. Then bursa is a basically small sac with synovial fluid. Here, basically these are the sac-like structure which are located near the capsule, and it is filled with synovial fluid. So basically, their function is provide cushion to the capsule. If there is an inflammation to the bursa, it will be called as bursitis. The patient will complain pain, swelling, and tenderness. For example, in knee, there is a prepatellar bursitis, which also known as house knee, or in elbow, there is an inflammation of olecranon process leads to olecranon bursitis, also known as Lugans elbow. Then moving to the types of synovial joint. Basically, there are 5 to 6 types of synovial joint. First, pivot joint. The pivot joint, uh, it is a basically articulation of a bone with another bone with ligament. Uh, for example, atlantoaxial joint found between T1 and T2 axial vertebra. Uh, And another example is proximal radioulnar joint. Uh, this will help in rotation of radius. So it will rotate the radius and allows movement for fora. Then next joint, which is hinge joint. Basically, in hinge joint, the convex end of one bone articulates with concave end of adjoining bone. For example, in elbow joint, there is articulation with trochlea of femur and trochlear notch of ulna. And other in include, for example, in knee, ankle, interphalangeal joint. Now, saddle joint. Saddle joints are functionally classified as biaxial joint. In the saddle joint, as the name saddle, it is a saddle shape articulating surface of the bone, which concave in one direction and convex in other direction. The primary example of the saddle joint is carpo-metacarpophalangeal joint between trapezium and first carpo-metacarpal joint. Then ball and socket joint. This is the most common joint found in body. It has a rounded head of one bone, which called as ball, which will fit into concave articulation known as socket of the adjacent bone. For example, in hip joint. In hip joint of femur will articulate with acetabular or acetabular cavity of the hip bone, and in shoulder it will the humors will articulate with glenoid cavity of scapula. Now plane joint. This is also known as gliding joint. The articulating surface of bones are flat or slightly curved, which allows the bones to slide with each other. So most common example is acromioclavicular joint. And in wrist, basically the carpal bone or intercarpal bone, and in foot, tarsal bone or intertarsal joint. This is about synovial joint. Thank you.